Lake Hamilton, Wolf families and friends. Shawn Higginbotham, your Superintendent of Schools, here today with an important health and safety message as we begin school for this 2021-22 school year. Joining me today is Dr. Kevin Hale, former Lake Hamilton School District Board of Director. Dr. Hale has had 4 children attend Lake Hamilton. He is also president of Health Star Physicians here. He's cared for our community for many years. We won't say how many years, but he's been a doctor in our community for many years. So welcome, Dr. Hale.
Thank you.
As we dismissed school last spring, we were almost, you could hear a collective sigh among our population when we thought we were at the end of this pandemic. And now, as we see things changing, we realize we were overly optimistic, perhaps. Garland County numbers have increased, according to health officials, from just 63 cases to almost 600 cases in a little over a month. What do you think is behind this spike?
Well, there's probably no question that the biggest thing behind it, Shawn, is this new Delta variant. As you know, viruses mutate, and so we have a mutation that according to the CDC is about 1,000 times more contagious than the initial COVID that we battled, earlier in the year. And so that's part of it. I think our vaccination rates are still low nationwide and certainly statewide, and I think that contributes to it. And then, I think that we have, a population that in some areas have some health issues. We all have a loved one, church member, family member that has a disease process that they've battled that makes them vulnerable to this virus. And so that's, I think those are contributing factors for certain.
You mentioned that it's this new variant that we're experiencing is more contagious.
Yes.
Do you agree with some reports that it's more lethal and maybe affecting a younger population?
Oh, there's no question. Yeah, in fact, we're seeing more and more young, what I say under 60 folks being hospitalized with this nationwide as well as statewide. And I noted last week, I think Children's had their first perhaps their first deaths of pediatric patients that were attributable to COVID. So
I've noticed that some of the media outlets have begun to report numbers from children's hospitals specifically. Correct. Because it's impacting that population more significantly. The school year begins in less than 3 weeks. How can we as parents and staff and leaders make the school the safest place possible, especially when it concerns reducing the spread of the virus?
Well, there are a number of different ways. I saw today on the news that the CDC had actually come out and reinstituted mask mandates, even amongst the vaccinated population, primarily because they found cases where vaccinated people could still spread it to unvaccinated. So mainly to help protect our community, particularly in hot spots. And Arkansas is considered a hot spot right now. Every county actually that reinstituted mask mandates. I think that getting our vaccination rates up, I understand that it's a controversial topic. Even inside my own medical group, there's some controversy about the vaccine, and I get that. I would just encourage parents and our community to look around at the credible medical institutions across the nation, inside our community, that actually recommend the vaccine. That would be places like the Mayo Clinic, Cleveland Clinic, Johns Hopkins, the UAMS in Little Rock, Children's Hospital that we all love and trust, CHI, National Park, all MD Anderson, Baylor, Baptist, all the credible medical institutions in the country, essentially, with their thousands of immunologists, pulmonologists, infectious disease experts still recommend this vaccine. I get that it's controversial. I get that it's a personal decision, but I would encourage everyone to learn more about it, particularly if you're unvaccinated, and make a decision that based on science and not necessarily TikTok or Instagram or Facebook. And listen, I love TikTok. I get some great recipes off that, you know. But I would say that it's better to look at the credible institutions. All of our community out there certainly at some point have a primary care provider, whether that's, you know, a physician, a nurse practitioner, a PA, whatever that might be that they've known and trusted. I would encourage them to talk with them as well, because I think increasing our vaccination rates will help. And then certainly we talked about masks, and then some of the things that our staff and faculty have been doing a great job, because I still have a child in school here, and so I hear about the cleaning efforts and all of that are still being done during the school year, and so I think you guys are doing an excellent job in that regard. So those are the things that I think would be most helpful.
Many parents of children under age 12 who can't get the vaccine and are not protected in that manner have concerns. What steps could those parents take to make sure that their child is as safe as possible in this setting?
Yeah, so statistically, when you look at it, the risk for a child under 12 of having a life-threatening or life-altering encounter with this disease is very, very small. That being said, you know, we talked about this earlier, from the day you could understand your mama's instructions. She talked to you about covering your mouth when you cough or covering your nose when you sneeze. And so I think that masks are still applicable here, encouraging them to wash their hands, to not share drinks with each other. There's just a lot of things. This is a communicable illness that you know, is spread as an aerosol, eyes, nose, mouth, and so those, you know, trying to avoid close contact with someone that's coughing or sneezing or, you know, creating aerosol, I think is important. Also, if your child is, you know, running fever or showing signs of illness, don't send them to school. I mean, I think that's important. And you know, listen, I'm as guilty as anyone. I want my child to be in school, in their seat, getting a good education. And so, you know, I think probably we'll have to pay more attention to our children this year. And if they're showing signs of illness, don't send them to school.
Do those screenings at home before they come.
Precisely. Or even put them on the bus, before putting them on the bus.
Right. We're going to have a school, I'm thinking of our middle school, where we have kids age 11 and 12, both vaccinated and unvaccinated.
Sure.
The best way to protect them, I think we've, you know, not to reiterate too much, but mask and the kids that are eligible for the vaccine to get the vaccine.
I agree with that. I'm not a vaccine shamer. I think this is an individual decision, but there are lots of things that we do in our life that maybe don't necessarily benefit us, but benefit our community as a whole. And that's what we are, we're a community. And so I think taking the vaccine where appropriate, provided you don't have you know, something that prevents you from getting the vaccine, I think taking the vaccine, whether you feel like you need it or not, is actually a benefit to our community as a whole. You know, when the polio vaccine came out, and we all understand that polio was a terrible, terrible illness. We had a president with polio. There were these same concerns about the vaccine, and they were legitimate concerns, because I'll be the first to tell you that the vaccine is not as safe as the flu vaccine. There are complications, but as with anything in life, as we talked about, you weigh the benefits against the risk, and I feel that the benefits far outweigh the risk in this particular instance. So I would encourage people to look very, very closely at the vaccine. And, you know, it's a personal decision. I understand that. We live in, you know, the land of the free. But again, there are decisions we make that are good for the benefit of the community.
We understand that you referenced the CDC changed their guidance just yesterday on face coverings for K-12 students, recommending those both vaccinated and unvaccinated because we're going to have a mixed population. And understanding that our legislature may do something before school starts, may convene in a special session, that's also in the news. But right now, our stance is to strongly recommend a face covering for all students on the bus and inside. Can you support that recommendation?
I can.
Okay.
I sure can.
All right.
I know my mother could. So,
is there anything else you'd like to add?
well, I just would like to say that I think everyone in this community wants to return to near normal as soon as possible. And I mean, we're fatigued of the mask mandates, the illnesses, the hospitalizations, our teachers, our police. It affects every segment of our population, really. And I think that our way out is, to continue to encourage vaccinations, to practice safe behavior when we're in crowded areas and that. And I think that's our way out. And so let's all work together. Let's don't make this political or controversial. Let's put a good positive face on this and try to move forward to the best of our ability. And I appreciate our school district and people like you and our teachers in that, because y'all are critical to our community.
Thank you, Dr. Hale, for your time and support. There's no bigger Wolf supporter than Dr. Kevin Hale.
You know, I bleed maroon and gold, you know that. So, always have, almost 32 years. So,
well, thank you for your time.
Thanks,
Appreciate it.
Appreciate it very much.